Hi, it's Dr. Wang here. Wanted to talk about medicine, finasteride. It's topical and it's kind of oral forms, but more the topical form because that's kind of been something that's gaining popularity here in the last few years. So, in the context of this medication, I want to talk about its use for male pattern baldness. So, this is something that 2/3 of men will have by age 35. They'll have some kind of problem with it. And this is one of the most common medications that people use. One of the main drivers of male pattern baldness is hair follicles sensitive to DHT, dihydrotestosterone. And what finasteride does is it reduces dihydrotestosterone by inhibiting the enzyme that converts testosterone into DHT. So finasteride comes in two dosages orally, 1 milligram and 5 milligram. 1 milligram is the one you see more commonly prescribed for male pattern baldness, whereas the higher dose 5 milligrams is more commonly seen for things such as BPH, problems with the prostate. Interestingly enough, both the 1 milligram and the 5 milligram has been shown in studies to both approximately reduce your total DHT levels by about 70% in serum circulation. Also, it is a relatively short half-life drug, a half-life of approximately 6 hours. Both of these two facts will come into play later when we talk about the topical formulation. But first, some more discussion about 5-alpha reductase. So this enzyme comes in three main variants. The type 1, which is mainly in skin and liver. Type 2, which is mainly in prostate, which also happens to be the one finasteride is most active on. And also type 3, which is peripheral, which is possibly skin, brain, and breast. And this one also has some activity by finasteride. Notably, finasteride does not really affect type 1, which is the predominant one in the skin and the liver. So what this means is how finasteride works is it's mainly reducing your serum dihydrotestosterone by working in the prostate and blocking this type 2 to reduce your total systemic DHT, dihydrotestosterone. So you can think of it as coming in by mouth and then going to work mainly in the prostate, but a little bit of type 3 as well, but mainly in the prostate, and from there reducing your total serum dihydrotestosterone levels by about 70%. So main problems that people have with finasteride, especially the oral formulation, is that they have sexual side effects. It doesn't happen to everyone, but they'll have problems such as decreased libido, impotence, they have problems with erectile dysfunction, and this is when topical finasteride comes into play because it offers an alternative to basically reduce these side effects that have lower. So topical finasteride. So as opposed to oral finasteride, which requires a prescription, topical finasteride is made by compounding pharmacies and available over the counter. Is it effective? That's the biggest question. So there have been some studies that have come out that have compared oral with topical finasteride, and they've shown that it's possible that it could be just as effective. But interestingly, from a pharmacological perspective, it's interesting that, but from a physiology perspective, it raises some questions because, like we talked about earlier, how finasteride generally works is that it reduces your total serum DHT levels by going to the prostate and working on the type 2 5-alpha reductase. With a topical finasteride, it's basically just staying on the skin, on the scalp. So the question is, well, how is it exactly working? Possible it could be working on the type 3, or maybe there's some small amount of type 1 cross-reactivity. Or it could be, like we talked about earlier, the potency of the drug, even at a lower dose, could just be causing enough systemic absorption for it to be effective. And its effectiveness could be a little bit on the longer side because it's kind of just staying on the skin. Whereas the oral finasteride, it's got a short half-life of only about 6 hours systemically. Um, uh, should you use it? I don't think topical finasteride, as of right now, because we still need more evidence on it, is a good replacement for oral finasteride in terms of effectiveness. It's something that you can supplement your oral medications with. I think that could be viable. Um, so should you use topical finasteride and just stop the oral formulation? As of right now, I don't think there's quite enough evidence to show that it is just as good. I think you should stick with the oral finasteride if you're tolerating it okay. But there are also risks with the topical finasteride. Uh, Being a medication that's made by compounding pharmacies and available without a prescription, there are some risks with the medications that I feel like everyone should know that I don't think are quite talked about. As a liquid, as a topical liquid, this medication just can go basically everywhere. It's not like a medication you put in your mouth and you swallow it and then it's within you. This medication is on your skin, can transfer to other objects, can transfer to other people. And that's where I think this medication gets into problems. So DHT in adult males is not a terribly important hormone, but in children, pregnant women, people that are developing, this does play an important role in developing sexual characteristics. And that's where it can get in trouble, is you could accidentally harm someone that you don't intend to give this medication to. So in summary, if you're currently taking oral finasteride 1 milligram daily and you're tolerating it well, I think you should just continue that and skip the topical finasteride. Um, but if you're considering if you should take oral finasteride or topical finasteride as a new medication, I think you should talk to your doctor first and see if you can get an oral finasteride and see if it's a good fit for you. Um, and if it isn't a good fit, then you could consider the topical formulation. The problem with the topical formulation is that it's not a regulated prescription medication. It's just something that's compounded by pharmacies. And there's some evidence of effectiveness, but it's not terribly conclusive as of right now. And there are unintentional side effects and transfers to other people that I think people should be aware about. Um, but another medication that I think should be on everyone's radar is dutasteride. So this medication is quite a bit different from finasteride, whereas it works on the type 1 as well as the type 2 and 3. And this is a video I'm going to make later here. So making videos is a new hobby of mine. I'm going to try and upload something every Saturday. Next medication or next video I'm going to make is going to be on dutasteride here. So like and subscribe if you want to see more. Thanks.